In this screencast, we're going to be looking at some blood vessels of the thoracic cavity, some of the abdominal pelvic cavity, and some vessels related to those locations. It's important that you consult your lab practical list because some items may not be on your list that you see here, and also some items on your list may be missing from here. Your instructor may be adding comments to the file description on your online site, so you might want to be checking just to see if there is any additions or deletions or statements about this. Looking at the thoracic cavity and some related vessels. Here we have the aorta coming up and around, and this is coming up from the left ventricle. Here, where the aorta is going up, if you will, or superiorly, taking blood toward the head, this is the ascending aorta. And then right here where it curves and these three branches are coming off is the arch. And then it's going to dive down behind, posteriorly to the heart, and become the descending aorta. It will go through the diaphragm and continue. So that's descending aorta. Coming off of the ascending aorta, you see the red vessels on the heart. Those are the coronary arteries. After that, the next branch off the aorta is right here. You can see it kind of sneaking up behind until it splits. This is the brachiocephalic artery, brachial arm, cephalic head. So it's taking blood to the arm and to the head on the right side. There is only one brachiocephalic artery, so you do not want to include left or right. Then it's going to split into the common carotid and the subclavian. So these are your right common carotid and right subclavian arteries. The left common carotid comes off of the arch by itself, and the left subclavian comes off the arch by itself. These are all arteries. The subclavians go under the clavicle and out toward the arm. The common carotids go up the neck and will eventually split into internal and external carotids. The pulmonary trunk comes off of the heart from the right ventricle. Now, why is this blue? Because it is low oxygen blood. The pulmonary trunk is an artery. All arteries take blood away from the heart. So we have blood coming away from the heart, therefore it's an artery, and it's blue because it's low oxygen. And it's going to split into the left and behind all of this right pulmonary arteries. So the trunk branches into the pulmonary arteries. Looking at some of the veins that we can see here then, the blue vessels on the heart, these are your coronary or cardiac veins, and those will eventually lead to a spot on the back of the heart called the coronary sinus, which will lead into the right atrium. Here we have the superior vena cava, which will drain low O2 blood into the right atrium. And behind the heart, which you can't see here, we can see it here, the inferior vena cava coming up through the diaphragm behind the heart, it will also dump into the right atrium. So these are your vena cavae. Now, when we look at the superior vena cava, we have this and this vessel branching in to bring blood toward it, and these are your brachiocephalic veins. There are two, so there is a left and a right. Always remember you're talking about the patient's right and left, not yours. So when you have an anterior view like this, it's opposite. So these are the brachiocephalic vessels, brachio and cephalic, right? Arm and head. So the jugulars come down the neck and the subclavians come in from the arms. So as we look over here, we have our right subclavian and over here our left subclavian veins that bring blood back toward the heart. And then here's jugulars. This larger one, see it's coming from the jugular foramen and coming down. That is the right internal jugular vein. And then you see on the outside of the skull, this one coming down, that's the external jugular vein. So these are on the right side, right, external and internal jugular veins. Now on this side, we see the left internal. And then because the head is turned, we don't see the external, but you can tell by its size being the same as this side, that it would be the same, in other words, the internal coming down from the skull. The Pulmonary veins were coming back from the lungs. Now, veins they're called veins because we're coming toward the heart, not away. And because we're coming from the lungs, the blood is now oxygenated, so these are red. And we have two coming from the right side and two coming from the left side. And these will be the pulmonary veins. So that's a look at some of the things we can see in the thoracic cavity. Let's move on then to the abdominal pelvic cavity and related areas. Looking at arteries first. Now remember, arteries away from the heart. And we are only now looking at systemic circulation. So all of the arteries are going to have oxygenated blood and be red, and all the veins are going to have deoxygenated blood and therefore be blue. So as we're coming down through the diaphragm, here we have our descending aorta again, but it can also be called the abdominal aorta because we're now in that cavity. This first little stub coming off of the aorta is the celiac trunk. One of the vessels from that is this red vessel coming out to the liver, which that makes sense why that would be called the hepatic artery. Then these vessels in red, kind of behind here, coming out to the kidneys, those would be the renal arteries, left and right because there's one on each side. Then the split down here, the big split inferiorly, is our common iliac arteries. So the left and right commons, and then they're called common because they're going to split again into the internals and the externals. So the little branch going into the pelvic cavity, these are the internal iliac arteries, and the larger one headed out toward the leg is going to be the external iliac arteries. Again, lefts and rights, don't forget to use those. Once we get out onto the leg and out of the pelvic cavity, now we are talking about the femoral arteries. So here we have the left femoral and the right femoral artery. In terms of veins, if we start back up toward the top here, here's the inferior vena cava. Now remember, we're bringing blood back toward the heart. This will go through the diaphragm and back up behind the heart to the right side like we talked about. So here's your inferior vena cava. The hepatic portal vein, if you're learning that, this is the purple one. Whereas in blue, that's the hepatic vein. So hepatic vein, hepatic artery, hepatic portal vein. The renal veins, of course, are the ones coming from the kidneys toward the inferior vena cava. So left and right renal veins. And then the iliacs have the same branching pattern as the arteries. So these two major, you have to look behind this artery, but these two major ones would be the common iliacs. The little ones going into the pelvic or coming back from the pelvic cavity would be the internal iliacs. And these larger ones split off from that would be the external iliacs. And once you're outside of the body cavity on the leg, this would be the femoral. Now, here we can see that the femoral vein continues down here, but this major split that's sort of medial on the leg, that's the great saphenous vein.